I just want to say a few words about why the social and political moment in which we find ourselves is particularly powerful. Many of you in this audience have probably seen or at least heard about Michael Moore's 2007 documentary, Sicko, on the failures of our for-profit healthcare industry. In that documentary, he interviews former British parliamentarian Tony Benn. Moore asks Ben about the birth of a national healthcare system in the United Kingdom. Ben responds, quote, "Well, if you go back, it all began with democracy. Before we had the vote, all power was in the hands of rich people. If you had money, you could get health care, education, care for looking after yourself when you are old. What democracy did was to give the poor the vote, and it moved power from the marketplace to the polling station, from the wallet to the ballot. What people said was very simple. They said in the 1930s we had mass unemployment, but we don't have unemployment during the war. If you could have full employment killing Germans, why can't you have full employment by building hospitals, by building schools, recruiting nurses, recruiting teachers? If you can find money to kill people, you can find money to help people." In the midst of their extreme post-Second World War economic devastation, the British people demonstrated their solidarity by nationalizing their healthcare system. 70 years later, we live in a very different world. Neoliberal capitalism has swept the globe. Healthcare systems around the world are succumbing to privatization as they undergo unparalleled budget cuts. What were once robust single-payer and national healthcare systems are now two-tier healthcare systems in which younger, healthier, lower-risk patients are cherry-picked by commercial providers to receive better and faster care. Premiums, deductibles, and copays are introduced or increased. The result in every instance is greater social and economic inequality. These unprecedented levels of social and economic inequality have brought us to the brink of fascism. At its core, fascism combines enormous economic discontent caused by neoliberalism with the crisis of white supremacy and a deep sense of emasculation. The underlying theme of our panel is this: Medicare for all and its recent growth in popularity is intricately linked to a much broader fight for participatory democracy and against proto-fascism and its highly toxic radicalization of the right. Yes, Medicare for all guarantees health care for everyone. Yes, it also delinks health care from employment status, restoring enormous industrial power to working people. But what our enemies fear most is this: Medicare for all gives a fifth of our economy back to the people and increases the size, strength, and power of our democratic government. When the findings of the Libertarian Mercatus Center study on single payer were released midsummer, we witnessed the study's author, Charles Blehaus, make a fascinating about-face. Those of us on the left were justifiably delighted by the fact that a libertarian study demonstrated a $2 trillion savings in our national health expenditure over a 10-year period. For Blehaus, the emphasis was instead on the significant increase in our federal health expenditures to $32.6 trillion over that same 10-year period. The libertarian agenda was laid bare. It is not interested in reducing our astronomically unsustainable national health care spending. Even the proliferation of opportunities for privatization in our healthcare system is a secondary priority. The ultimate aim is to use healthcare reform as yet one more systemic vehicle to shrink the power and reach of our democratic government. It is not hyperbole to say that our fight for Medicare for all is a part of a much broader struggle to unchain democracy, to borrow phrasing from historian Nancy McLean. The values that undergird Medicare for all, fairness, equity, universality, as well as the values of the nurses, caring, compassion, community, are values inherent in democracy and are values that almost every single social justice movement can get behind. Since Jean Ross, co-president of NNU, can't be here due to a last-minute family emergency, she asked for me to deliver the remarks that she prepared. And I really just want to say that this panel was organized by National Nurses United. We are a union, bedside nurses, 155,000 members strong. We have, since our inception, supported Medicare for all and fought for Medicare for all. So now, from Jean. I've been a registered nurse for 40 years. As a nurse, I am on the front lines of our country's acute healthcare crisis caused by an immoral healthcare industry that prioritizes profits over humanity and healing. Because nurses work directly with human beings when they are at their most vulnerable, we have a special vantage point into how to fix our broken healthcare system. I'm going to safely assume that many in this room agree that our healthcare system, with the private insurance industry, big pharma, and for-profit hospital systems in the driver's seat, is irretrievably broken. A good portion of us likely concur that the only way forward is Medicare for all. It guarantees healthcare for everyone, cements into law healthcare as a fundamental human right, and ensures human lives are valued over corporate profits. Today, you will hear a lot about why single payer makes fiscal and social sense. I want to discuss why Medicare for all is the only way forward if we are to ever live in a truly just, caring, and moral society. For nurses, the moral argument for Medicare for all is intricately interwoven with the policy argument. Every day, by virtue of our caring labor at the bedside, nurses witness people refusing or being denied treatment and medication due to cost. Perhaps their insurance doesn't cover the treatment, or they, like over 40% of Americans, cannot afford copays and deductibles, or they, like close to 30 million Americans, simply have no insurance. This is morally deplorable. One's ability to stay alive should never be based in someone else's ability to make a profit. From the standpoint of nurses, we need Medicare for all first and foremost because it gives our patients health care on the basis of need, not ability to pay. But we also need Medicare for all because it helps us directly address the core underlying problems that cause illness in our patients and broader social ills, social, economic, and racial inequalities and injustices, immense economic insecurity caused by neoliberal capitalism, the stress on working families of mounting medical debts, the frustration and despair caused by losing coverage when our patients lose their jobs, oftentimes right at the very moment when their families most need health care, and the division and resentment bred by means-tested solutions like Medicaid. Over the past several months, I had the privilege of traveling to the United Kingdom, Canada, and Cuba to better understand the national healthcare systems and single-payer healthcare systems of these countries. To be sure, all three share a fundamental similarity that it is at odds with our healthcare system. In each of these countries, accessing patient care is based on need and not ability to pay. Nye Bevan, the former miner who went on to become a member of British Parliament and the founder of the National Health Service, rightfully observed the impact the NHS had on enriching every aspect of British society. Quote, "Society becomes more wholesome more serene, and spiritually healthier if it knows that its citizens have at their back of their consciousness the knowledge that not only themselves, but all their fellows have access when ill to the best that medical skill can provide, end quote. The arrogance of our market-driven society tricks us into thinking that the moral argument is not sufficiently sophisticated or pragmatic to drive high-level policy discussions and considerations. Yet I learned from my experience in these countries that the moral argument for a mission-driven healthcare system is really the only argument strong enough to create the political will necessary for the full realization of healthcare as a human right. In the Canadian and UK healthcare systems, privatization and corporatization are rearing their ugly heads. The experience of both countries is a cautionary tale of how conceding to market-driven concerns ends up eroding and undermining the entire healthcare system. Yet Cuba has managed to create a healthcare system deeply aligned with the political will of the people. I want to spend just a moment discussing each of these healthcare systems. Canadian Medicare guarantees healthcare to all their residents. It is publicly administered, comprehensive in coverage, universal, portable, and free at the point of care. Nevertheless, Canada is the only developed country in the world with a universal healthcare system that does not cover essential prescription medications prescribed outside of a hospital. Because of this, patients actually try to be admitted into hospitals to receive desperately needed medications. Coupled with the greed of the multi-billion-dollar pharmaceutical industry, this system has made drug prices in Canada the third most expensive in the world. The result is that 1 in 5 Canadian families cannot afford their prescription medications. This is why nurses, along with the Canadian Labour Congress and other advocacy groups, have come together to launch a campaign for national pharmacare, a single-payer, universal prescription drug program for all Canadians, which will save Canada about $4.2 billion each year. The National Health Service in the United Kingdom is a publicly funded national health system that provides comprehensive, universal care free at the point of delivery. All citizens in the United Kingdom are guaranteed a full breadth of critical and non-critical Medicare services without payment. But this system is in grave danger, as you will hear more about from Hasnia in just a moment. In recent years, establishment politicians have worked with private interests to transform the NHS from an integrated public service to one reliant on expanded private sector involvement. What is happening right now in the NHS is a prime example of the austerity, then privatization formula. A public system gets starved by austerity measures, enabling the private sector to act as a knight in shining armor, saving the starving system from itself. For me, the greatest hope is to be found in the Cuban healthcare system. What I witnessed is a genuine universal system that provides Cubans outpatient care, hospitalizations, pharmaceuticals, optometry, dental care, and whatever is required for the full restoration of health. So it's not surprising that Cubans are among the healthiest people in the world. The child mortality rate is equivalent to that of the United States. The child mortality rate is lower than some of the world's richest countries. Life expectancy is equivalent to that of the United States. Actually, the United States has a worse child mortality rate. And vaccination rates are among the highest in the world. Cuba achieves all of this while spending only $813 on healthcare per person each year. Meanwhile, our country spends $10,349 per person each year. What I found primarily separates the Cuban system from all others is that healthcare is viewed as a fundamental human right and is written into the Cuban Constitution. Social determinants of health are understood as integral to overall health, and as a result, the country is committed to ensuring all people are housed, fed, and educated. Indeed, Cuba's literacy rate is 99%, and health education is part of the mandatory school curriculum. Cuba lives the morals and values the left espouses. I experienced Cuba's healthcare system as mission-driven, not market-driven. It is devoted to creating life-saving treatments for the many, not profits for the few. My story of Cuba isn't just about guaranteeing healthcare for everyone for much less than what we pay in the United States. It is a story of inspired and compassionate moral and political will. It is a story of a country whose people have come together collectively to make a decision that caring for one another is more important than profiting off of someone else's suffering. A lack of health care is not the result of limited resources. If a country makes it a priority to care for its people, then it will care for its people. The only thing that stands in the way of us winning Medicare for all in the United States is a lack of this political and moral will. But this collective will is growing, as we saw by the astonishing number of pro-Medicare for all candidates who won during the midterms. People are starving for a system that embodies health care as a human right. They are searching desperately for leaders with enough courage to legislate that system into being. In closing, here's what we know for sure about our struggle. We know the pharmaceutical and insurance industries are coming for us with every weapon in their arsenal. We know that these industries will line the pockets of the shape-shifting extreme center of the Democratic Party in an endeavor to sabotage our efforts with a public option. We know that the nurses and our allies will have to literally inoculate the public against our enemy's agenda harder than we ever have before. We know that we will not win our fight if we do not cultivate and harness the expansive will of a grassroots who is deeply exhausted from a healthcare system that profits from their pain and their suffering. We know that the political will of the people is not built on the fine intricacies of policy debate, but is built on the deep collective recognition that our current system is immoral. Our ability to change that system is simply a matter of strategically harnessing our people power. We know that the nurses will continue to lead this effort as we have been doing for decades. We know how to fight for the most vulnerable, how to educate and problem solve. The public trusts and respects us precisely because we always put our patients' needs first. And right now, we need to put humanity's needs first and fight for Medicare for all. And finally, we know that our time for a just healthcare system has come. Thank you.